Sonia, if you could stand as you are, and if you could come just a bit further forward. There you go. Now, most people when they stand, not only pregnant women, do stand with their hands on their hips. So if you could just start you off with your hands on your hips. This is quite common, and especially so with women, which we call the pregnancy pose, when their hands are actually in the back of the hips, whereas most people stand with their hands slightly forward with the thumbs in the back there like that. But as you go into pregnancy, it tends to switch. Now, what this actually does is it arches your back even more. So you can, in fact, get more tightness in the lower back. It does tend to alleviate pain because it's actually pressing the pain receptors, so it feels like it's good, but in actual fact, you're tightening those lower back muscles even more and causing more compression on the discs as the muscles tighten. So what we really need to do is try and eliminate this type of standing as much as you can. And also, when you're standing like that, what tends to happen is, if you place the hands back on the hips again, Fiona, just there, it tends to push the hips forward like that, and these muscles then tend to tighten. As these tighten, the attachment to the hip bone here tends to pull even further forward, so you get more of a tightening in the lower back because the stomach muscles just aren't there in order to support the back. So what we'd like to try and do is, if you can, you're going to try and lengthen out the lower back by tucking the pelvis. So imagine the hips are just rotating back, but you're trying to keep the back as long as possible without arching. And in Fiona's case, when you just squeeze the shoulders gently together and keep your neck nice and long. So in actual fact, if you're standing, if you just bring your hand slightly forward, try and lift the rib cage on the sides away from the hips as tall as you possibly can in that position. So you have this section here between the ribs and the hips as tall as you can. If you bring your hand slightly forward there, that's it. So drawing this area up as tall as you can, tucking the pelvis under, and you can see how the back actually does stretch when that happens, and shoulders down, squeeze them gently together, and keeping as tall as you possibly can out of the hips. Okay? That should be your standing posture. So in Sonia's case, if you can turn sideways, Sonia, as well, with the advanced stages of pregnancy, you're going to find that this is actually going to also tend to arch quite considerably. So once again, you do need to tuck the pelvis a little bit. Okay? That will start to work some of the abdominal muscle groups, which is fine, but it will take the pressure off the back. And once again, keeping the ribs as tall as possible away from the hips, with the neck long, and the shoulder blades gently squeezed together. Okay? So this is very, very important insofar as we were trying to take the pressure off the back. So it is important to stretch the front of the thighs, and also to maintain that little bit of a tuck to take the pressure off the back. It may not feel comfortable to do it first, but once you get used to it, you'll find out how much it does alleviate